Can exercise truly be the secret to keeping our minds sharp as we get older? It's a question that really resonates, I think, especially with cognitive health being such a big concern these days.
It absolutely is.
And today, we're actually unpacking some fascinating new research that dives right into this. We're looking at a paper called The Effect of Aerobic or Strength Training in Elderly with Cognitive Decline, the Fit 4-Outs project.
Mm-hmm.
This is by Filipa Silva and her colleagues. It was published just this year, 2025, in the Journal of Sports Science and Medicine. That's volume 24, pages 172 to 186. It went online March 1st.
Okay.
And for those who want to find it, the DOI is https://doi.org 10.52082 JSSM.2025.172.
Right.
So our mission really for this deep dive is to explore what this study found about different kinds of exercise with and without cognitive training, specifically for older adults who are, well, already dealing with some cognitive decline.
And that last point you made is just so crucial. This study is really important because, well, we know cognitive decline, conditions like dementia, they're becoming more common as populations age.
Right.
So finding effective ways to intervene, especially things that aren't drugs, is critical. And what's really valuable about Fit4Alls is that it zeroed in on people already showing signs of what we call mild cognitive impairment, or MCI.
Not just healthy older adults.
Exactly. Not just healthy controls. It targets this group that really needs strategies to, hopefully, slow things down.
Okay, before we get into the study itself, maybe you could help set the scene a bit. Like, when we talk about cognitive decline, what does that actually cover? And how do terms like dementia or Alzheimer's fit in?
Sure, absolutely. So when we talk about cognitive decline, you can think of dementia as the big umbrella term. It's basically a collection of symptoms, things like memory loss, problems with thinking, language issues that get bad enough to interfere with someone's daily life.
Okay.
And under that umbrella, Alzheimer's disease, or AD, that's the most common culprit. It accounts for, well, a huge chunk, something like 60 to 80% of all dementia cases.
Wow, that many.
Yeah. It's a progressive disease, it damages the brain, and it really impacts those key cognitive functions, how fast you process things, your executive functions like planning and decision-making, memory, obviously, even things like understanding spatial relationships. And all that, sadly, affects independence.
And you mentioned aging is the biggest risk factor. I think I saw something like 81% of Alzheimer's cases are in people 75 plus.
That's right. Aging is the biggest factor. But it's not just about age. And that brings us to mild cognitive impairment, or MCI.
Right, MCI. How's that different?
Well, MCI is like an earlier stage. People with MCI, they notice cognitive issues, maybe memory lapses, finding words, they have complaints. But crucially, they can still manage their daily activities pretty well. They're independent.
Okay.
It's a really critical window because some people with MCI do go on to develop dementia, but not everyone does. And the really exciting thing, which this study kind of builds on, is that the aging brain and body, they're not fixed. They have this amazing plasticity.
Plasticity meaning they can still change and adapt.
Exactly. They can actually improve through systematic training. It's not like it's all downhill after a certain age.
That idea of plasticity is huge. And it links right into prevention, doesn't it? I remember reading that a lot of risk factors for Alzheimer's might actually be preventable.
You're spot on.
Yeah.
Estimates suggest something like 54% of Alzheimer's risk factors are preventable. And right near the top of that list, physical inactivity.
Really?
Yeah, there was a big meta-analysis. Hamer and Cheetah back in 2009 looked at loads of people, over 160,000. They found physical activity cut the risk of dementia overall by 28%, and for Alzheimer's specifically by 45%.
45%, that's massive.
It's a really strong link.
So, okay, let's unpack that. It's not just about, stronger muscles or better heart health, though that's important. How does exercise actually help the brain on a biological level? What's going on in there?
That's where it gets really cool. There are several proposed mechanisms, and they're pretty compelling. First off, exercise improves blood flow to the brain, better plumbing, basically. More oxygen, more nutrients getting where they need to go.
Okay, better delivery system.
Exactly.
Yeah.
And second, it seems exercise can actually increase the volume of gray matter. The brain tissue itself, especially in key areas like the frontal regions, which handle those executive functions we talked about.
Planning, problem solving.
Right. And also the hippocampus, which is absolutely vital for forming new memories.
Right.
And then maybe the most exciting part is that exercise boosts levels of what we call neurotrophic factors. Think of them as like fertilizer for your brain cells.
Brain fertilizer, I like that.
Yeah. So things like orexin A, that's important for attention, working memory, protecting neurons. And then there's BDNF, brain-derived neurotrophic factor. That one's huge for neuron growth, learning, memory, overall cognition.
BDNF, I've heard of that one.
It's a big player. And you also get increases in things like IGF-1, insulin-like growth factor 1, and VEGF, vascular endothelial growth factor, which help build new blood vessels in the brain. So there's this whole cascade of positive effects just from getting moving.
Wow, it really is like a whole internal tune-up for the brain. So, given all that biological potential, how did the Fit4Else project team actually set up their study? What were they trying to find out specifically?
Well, they saw some gaps in the existing research. They wanted to look really closely at the effects of, specifically, aerobic training, cardio versus strength training and resistance work.
Okay.
And they wanted to see what happened when you did those alone compared to when you combine them with cognitive training, like brain games.
Ah, so physical plus mental training.
Exactly.
Yeah.
And a key question for them was, could strength training by itself actually impact cognition?
Yeah.
Because sometimes it gets less focus than aerobic exercise for brain health.
Mm-hmm.
And also, does combining physical and cognitive training give you like a bigger bang for your buck than just doing one?
Makes sense.
Yes.
And who were the people in the study? You mentioned they already had some decline.
Right. They recruited 154 older adults. Average age was around 73. Almost 70% were women, which is actually fairly typical for that age group in Europe.
Yep.
And the crucial bit, every single one of them scored below 26 on the MoCA test, the Montreal Cognitive Assessment.
Which means they already had mild cognitive impairment.
Precisely. They weren't starting from a baseline of perfect cognitive health. They were already in that MCI category.
So how did they compare the different approaches? What did the actual training look like?
They split the participants into 4 groups for 12 weeks. You had STCT, that's strength training, plus cognitive training.
Got it.
Then ST, just strength training. Then AT, just aerobic training. And finally, ATCT aerobic training plus cognitive training.
So covering all the bases.
Pretty much. And everyone trained 3 times a week for an hour each time. For the groups getting cognitive training, that involved 20 minutes of specific computer-based exercises targeting memory, attention, and executive functions.
Okay, 12 weeks, 3 times a week. And how did they measure if it worked? What were they looking for?
They used 2 main tools, before and after the 12 weeks. For cognition, they used that MoCA test again.
The same one used for screening.
Yes. And for physical performance, they use the senior fitness test. That's a whole battery of practical tests, things like how many times you can stand up from a chair in 30 seconds, arm curls, a 6-minute walk test for endurance, plus flexibility and balance tests. So they looked at both mind and body changes.
All right, the moment of truth. Let's get to the findings. What happened physically? Did the participants get fitter?
Yes, definitely. That's the really clear positive news here. The study found significant improvements in overall physical performance across most of those senior fitness test measures.
Like what specifically?
Things like the 2-minute step test, the arm curl, chair, sit and reach for flexibility, the back scratch test also for flexibility, the 8-foot up and go for agility and balance, and the 6-minute walk for aerobic endurance. So yeah, the participants definitely got physically fitter.
That's great. Maintaining that functional ability is so important.
Absolutely. It helps with independence, quality of life, everything.
Were there differences between the groups? Did aerobic help more with one thing and strength with another?
Yeah, there were some interesting nuances. For example, the aerobic training only group, AT, actually showed greater improvements in upper body strength, the arm curl compared to the strength groups.
Really? That's surprising.
A little bit, yeah. And they also did better on the 2-minute step test. It suggests aerobic exercise might have wider physical benefits than we sometimes assume.
Huh. What about the combined groups?
The ATCT group, aerobic plus cognitive training, they saw the biggest jump in aerobic endurance on the 6-minute walk test. And they also had significant gains in flexibility and balance. The researchers wondered if that dual tasking, engaging brain and body together, helped with that neuromuscular coordination.
Interesting theory.
Meanwhile, both strength groups, ST and STCT, predictably showed good improvements in lower limb strength and endurance, like in the chair stand test. And the STCT group, strength plus cognitive, actually improved more on one flexibility test, the chair sit and reach, than the ATCT group did.
So clear physical gains all around, with some specific advantages depending on the type of training.
Exactly. The physical interventions definitely worked in terms of improving physical function.
Okay, so now for the big question. They got physically fitter, but what about their cognitive function? Did the MoCA scores improve?
Well, this is where things get fun.
Oh,
Perhaps surprising or maybe even a bit disappointing for some. Despite those really solid physical improvements across all the groups,
yeah.
the study found no significant improvements in cognitive function as measured by that MoCA test.
None. Not even in the groups that did the cognitive training, too?
Nope. No significant changes on the MoCA for any of the four groups.
Hmm.
STAT, STCT, ATCT, none showed a statistically significant improvement in their cognitive scores over the 12 weeks.
Wow. Okay. That is a really critical finding, especially given all that biological evidence we talked about, the BDNF, the blood flow. Why wouldn't that translate into better test scores, particularly when they added brain training? What did the authors think was going on?
That's the million-dollar question, isn't it?
Mhm.
And it does seem to contrast with some other studies that have found benefits, especially from combined training.
Right. So why the difference here?
The Fit for All's authors offered a couple of really important potential explanations. First, they questioned the tool itself. The MoCA test, while good for screening for MCI, might just not be sensitive enough to pick up small, subtle cognitive improvements, especially over a fairly short period like 12 weeks.
Ah, so the changes might be happening, but the test isn't fine-grained enough to catch them.
That's one possibility they raise. The other major point is the duration. 12 weeks, while enough to see physical changes, might simply not be long enough to produce significant, measurable cognitive gains in older adults who are already experiencing decline.
How long might it take then?
Well, the paper suggests that meaningful cognitive adaptations, the kind you'd see reflected in test scores, might require much longer interventions. They threw out numbers like maybe 12 months, even up to 48 months, so 1 to 4 years potentially.
1 to 4 years? Okay, that's a much bigger commitment than 12 weeks.
It is. It suggests that while the biological wheels might start turning relatively quickly with exercise, actually translating that into improved performance on cognitive tests for this specific population could be a much slower process.
That really puts things into perspective regarding expectations for, say, typical fitness programs. You might feel better, get stronger, but seeing a jump on a cognitive test might take a lot longer.
Precisely. And it also highlights why research in this area can be challenging. Long-term studies are complex and expensive to run. We should also mention the sample mostly female. While some research hints women might get more cognitive benefit from aerobic exercise, that didn't pan out here, reinforcing the main finding about the lack of MoCA improvement over 12 weeks.
So, putting this all together, what's the main takeaway for you, our listener? What should you make of this study?
Well, I think the clearest message is that both aerobic and strength training are fantastic for improving and maintaining physical fitness and function in older adults. That came through loud and clear.
Absolutely. Helping people stay mobile, strong, and independent, that's incredibly valuable in itself.
Definitely. But the study also adds a really important layer of nuance about cognition. While we know exercise is good for brain health biologically and helps reduce long-term risk,
Yeah.
directly improving measurable cognitive performance on tests like the MoCA, especially in people already showing decline and over shorter time frames like 12 weeks, seems to be more complex. It didn't happen in this specific study, even with added cognitive training.
So the physical benefits are clear and relatively quick, but the measurable cognitive gains, at least in this context, might require more time or maybe different types of measurement or even different interventions.
That seems to be what this study suggests. It underscores the physical benefits while prompting more questions about how best to achieve and measure cognitive improvements in this population.
If you listening want to dig into the specifics, the exact exercises they use, the stats, the full discussion, you should definitely check out the original paper by Filipa Silva and colleagues.
Yes, it's worth a read.
Again, the title is The Effect of Aerobic or Strength Training in Elderly with Cognitive Decline, the Fit4Ls Project, in the Journal of Sport Science and Medicine. And please, do make sure you follow our channel and turn on notifications so you don't miss future deep dives like this one.
And maybe a final thought to leave you with. This study really highlights a key question for future research. We see these biological brain benefits from exercise. We know it reduces dementia risk. So what are the magic ingredients, the specific types of exercise, the right duration, maybe combinations with diet or other strategies that will reliably translate those underlying biological improvements into tangible, measurable cognitive gains for people already experiencing decline? It feels like a really important frontier we still need to explore.